Hi.
Hey, Dr. Sir. Do I pronounce it Sadr or Satar? Seder.
Whatever you want. It's like Sater, Sater, whatever you want.
Or how about Cima?
Yeah, better. I want to ask you about your family name. I couldn't pronounce it.
My last name, Gallagher or Brendan. Brendan.
Yeah, maybe it's easier.
Yeah, whatever you want. Whatever you want. So how's it going?
I'm good. I'm good. How are you? Thank you for
Good.
giving me the time for that. Honestly, I do understand, like with residency and everything, it is quite tough.
There's a lot of work, a lot of time, a lot of sorry for the background noise. I live across the street from the hospitals and it's it's very hot today in New York City. And so I have to keep the windows open. They haven't turned on the air conditioning yet. So I'm sitting here sweating.
Don't worry. Here in Cyprus, it's already summer. Like it's almost 30 degrees, so it's quite hot here as well.
Ooh, yeah.
Yeah.
Oh yeah.
Yeah.
Cool. I did take note of the questions that you sent me, so we could get into those. Um, great. And now I'll be able to send you the recording because this is going to record right to my laptop, and then I can forward
Okay,
that.
for sure. There's no problem. For me, it's not a problem. I have my recorder on as well, but sometimes it lags, so I need to update mine. This is why so if in case it lags, I'll just message you and because I usually do audio recording and I don't do video recording, so that's a first for me. I might start doing the video one soon.
Why not?
Uh because I don't have like the camera and all of the I want to start like nicely.
Hmm.
So
Hmm.
yeah, that's why I'm waiting for my whole setup to arrive so I can start with a video recording podcast. Yeah.
Okay, I gotcha. I follow. That makes sense. Yeah, you should do it. You should do it because it records both, and then you can put it out on
Yeah.
because Spotify uploads the videos now, and obviously
Yeah.
YouTube, and yeah,
Yeah, I'm
it gives
still
you a
not
bit more.
used to YouTube. I'm trying to get to know YouTube. I'm not a big fan. I don't know if my camera is okay because I cannot. Yeah, okay.
I think it's great.
So yeah, YouTube, I'm trying to understand how it goes with YouTube. I'm still
Mhm.
getting the hang of it. I understood podcasts like the Spotify and the whole thing, but YouTube, I'm still getting the hang of it.
Right. Yeah, it takes some YouTube's interesting because you have to really work on the thumbnail, like what gets people to click
Yeah.
on the video. Whereas I feel like Spotify is more of just people that follow you. I'm
Yeah.
trying to learn hashtags. I don't even know if hashtags work on Spotify, but it seems to
I
be. It's
think it does. It was working for me, so I think it does.
yeah, which is pretty cool. That's pretty cool.
Yeah. So if you have any questions before I start, because I usually start with a small introduction and then like I introduce my guest and then I go on and give you the discussion. So if you have any questions before we start or any clarifications, do let me know and then we can start.
Yeah, I mean, I don't have any specific questions. I mean, we could definitely chat too, because I wanted to see, what you're up to, where you're going, where are you at right now,
Yeah.
as far as the educational, everything goes. And then it looks like because this is on Zoom, I don't have the premium version, so this will only go about 40 minutes altogether.
Okay. If you want, I have the premium one, but whatever. Like I think it will be okay. We can
It'll be
like
fine.
have, yeah, I think it will be fine. Usually it takes me 40 minutes. So
Yeah,
yeah, we can
exactly.
go.
Sure. So go ahead. Yep.
Perfect. So, welcome to the Dental Talk podcast, where we explore the world of dentistry with industry leaders, with pioneers. In this episode, we are honored to be joined with Dr. Brendan Gallagher, an oral and maxillofacial surgeon resident. He is also a visionary entrepreneur, having co founded Top Dentist LSC, which is a platform dedicated to sharing the achievement of medical professionals. Also, he is the admin of a very well-known Instagram account, such as Students of Dentistry and Elite Dentists, as he has established himself as a trusted advocate in the dental community. So, welcome, Dr. Brandon, to the podcast, and thank you for joining me.
Please, just Brendan. Brendan, thank you, Seema. Thanks so much for having me on and helping to put this together. I know it's been a few weeks coming. Now, finally,
Yeah,
we got to get on here. Finally, got to connect. With the schedules that it's been difficult, and as well as the difference in our hours, right?
exactly. Huge.
So finally, yeah. So, one other thing to note. It's our most recent development. It's called the PreDent Mentor Map. It's It's a map of all the dental schools in the United States where pre-dental students, those in college, maybe even in high school, if they want to look at it early, it's a database for all the dental schools in the United States. It shows updated statistics, the DAT scores, the tuition amount, the class sizes, the average GPA that you need to get in, among a number of other things. It also has a discussion board, much like Student Doctor Network, to get some information there and connect with other colleagues, as well as we have mentors at most of the United States schools now. So you can connect with those students to ask them specific questions for that school. It's a free service for pre-dental students. We're trying to sign up as many dental students as much as we can now. And hopefully we can bring it throughout the world even. We want to start with the United States, and on Canada, Australia, Europe, and just keep going. I think it'll be really good to add to the profession. But without further ado, okay, so you wanted me to get into a couple questions here. The OMFS educational pathway in the United
Yeah.
States. Yes, 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 yes. So I don't know how it's not like medicine. It's not like
Yeah, it's
medicine
different.
where you can go to medical school outside of the United States, take the board exam, and then apply in the United States. It's not quite like that. Most
Okay.
areas require you to do about 2 years of dental school in the United States at a dental school that allows foreign trained dentists to come over.
Okay.
And dental school in the United States is 4 years. And we are required to graduate college first, all the prerequisites, the exams and stuff. Then we do 4 years of dental school, and then you could apply to oral surgery residencies. For international students, I believe, not necessarily college, but you do your dental school there, and then you're a dentist, right? But then you have to repeat 2 years for the most part generally in the United States, 2 years of dental school. So that's
Yeah.
not every program offers that either. And then from there, I think you can apply to oral surgery programs. It also depends on citizenship and a number of things. Um, so that's that. Now, once you're in or applying to oral surgery residencies in the United States, there are two different programs. There's one program that's 4 years. You just go in, you do surgery, you do rotations with other medical specialties in the hospital, medicine, general surgery, hand plastics, bariatric surgery, trauma surgery, general surgery, a number of them, right?
Yeah.
There's the 6 year track, though, too. There's an extra 2 years in the 6 year OMFS track because they get their MDs. Those 2 years are spent in medical school, and then they earn their MD. Now, the reason I didn't go for that, I'm in the 4 year track, is because if you have the self awareness to recognize what kind of oral surgery are you actually interested in doing every single day for your about 30-year career, right? I think that's kind of
Yeah.
important because in many residencies, they require you to pay for those 2 years in medical school. That could be upwards of 150, $200,000. That's a lot of money on
Yeah.
top of maybe dental school loans and other stuff. So in addition, it's time. It's 2 years of your life on top of 4 years of college, 4 years of dental school, on top of the 4 years already of residency. So
It's quite
there's
a
a lot to
lot.
consider
Yeah.
with it. It is. Now, what is the MD helpful for? Right? Because you're not going to be doing leg amputations in your dental office, in your
Exactly.
oral surgery office, right? So what is
Exactly.
the exactly right? So what is the actual benefits of the MD? Well, obviously it's an MD. It's a degree, it's a certificate, it's the whole thing. You have a lot of knowledge in those 2 years of medical school and more, right? It can help with applying to fellowships, for example, in plastic surgery. Maybe you want to do tummy tucks, breast implants, you want to do butt lifts and stuff. It could be helpful there. It could also be helpful for a fellowship in head and neck surgery, cancer resections, and so on and so forth. It could be helpful for that. It could be considered helpful when applying to a job in an academic center because you have an extra degree. They need to honor that. I don't know if it happens, but maybe you could get a higher salary. I don't think so, but maybe.
Yeah.
And research as well. Having the extra degree looks very good on research and publications and your works in that respect in the literature. But is it needed for any of those things? It's not. You can make a great argument, even as a 4 year degree oral surgeon, you could still apply to fellowships, other residencies, academic centers and stuff. So while it's not required, it's not necessary. It may be beneficial there. All right. I know it's a long answer, but it's a very important question that
Yeah.
I get asked quite
Well,
often.
and actually, it's like a quite tough and long pathway. So you really know, like you really have to know and be confident that this is what you want, because at the end of the day, it's quite a huge like it's a huge step, and it needs a lot of time, it needs a lot of investment into it. So yeah, I mean, it's
A
quite
lot.
a great, and I think that at the end of the day, it is really worth it if it is what you really want, if it is what you really like. So yeah, it is quite a great pathway if that's what you want. But is there any like skills or any something specific? Like for example, someone who knows that they want it, they like it, but is there something specific that a skill or like something that someone should take into consideration before entering this whole like investment, let's say, or this pathway?
The 6 year or the four, just oral surgery residency, or
Or
specifically the 6 year track?
no, like oral surgery specifically.
Oh, yes, yes. So it's very, in the United States at least, I'm not familiar obviously with other
Yeah.
countries and stuff, but in the United States, it really is the bridge between medicine and dentistry, right? It's a
Okay.
it's a very separated system in the United
Yeah.
States, and there aren't any medical doctors that get brought over to the dental side. There are, you could argue, two dentists that get brought over and kind of and bridge the gap between medicine and dentistry. And recently, as of what, 2 years ago, dental anesthesiologists became recognized as a dental specialty, right? And they spend their residency in a hospital setting and doing anesthesia, but then they no longer do any surgery. They don't do any dentistry with their hands anymore.
Yeah.
They're just doing dental anesthesiology, as far as what I was told. Oral surgery is still all of everything. We are doing the anesthesia. We're doing all of it. We do 6 months on a full on anesthesia rotation. We do our own sedations and stuff, and then we do surgeries of the head and neck. So it's it's a lot. It's a lot, and residency, the hours of residency, and they vary between different programs. They take a lot of time. It's a lot. It's a lot of weekends. It's a lot of sacrificing into your 30s.
It is.
When I graduate, I'm going to be 31 years old in just over a year now, and it's a lot of time. I've been in postgraduate education since I was 18. So well, postgraduate since high school, you have college
Yeah.
and there, but it's just a lot. It's a lot. You need to be able to expect that and know. And you know, healthcare and dentistry and medicine, it's all changing. It's all changing.
It
The reason
is.
why it's changing is because insurance is heavily involved now. But
Yeah.
insurance, one, they don't reimburse everything, even things that are required and necessary, medically necessary to
Okay.
get. They're not reimbursing
Yeah.
everything. And what they are reimbursing, it's not the full amount of what it's worth, of what it costs. And if you look at the trajectory over time, dental insurance became more available and popular between the 60s and 70s. Inflation has increased over that time, but the
Yeah.
reimbursement of dental treatments has not increased significantly. And everything else has. Inflation has gone up. The costs of goods, materials, and technology has gone up substantially, as well as the education to become a doctor, a dentist, a lawyer, so on and so forth. Everything's gone up. Everything has gone up. So we're really starting to see a squeeze between the amount of debt students, dentists, doctors, lawyers have, and the amount, so the overhead, if you will,
Yeah.
versus the reimbursement. So the ROI has never been lower than today. It's becoming a tough profession. There's a lot of patient distrust as well, which is interesting. You go on TikTok, YouTube, Google, Chat GPT now, and there's so many answers out there. And there's so
Yeah.
many
Exactly.
different answers telling you different things. So when you go in and see that dentist, it's natural to want to get a second opinion. It's natural to Google things. But it's becoming ever more like people aren't using fluoride when they brush their teeth now. How did this become
A thing,
something?
exactly, exactly. I mean, so many people ask me about it and they keep on telling me this said, this person said that. I read that online and I'm like, please, like, go on reliable sources. And I try to understand where they got this source from. Yeah, I do agree with you. And unfortunately, misinformation is being spread so easily and so quickly. I mean, it's easier than us. So many times patients are like coming and telling us those facts as if they are like I don't know, like they are so into this information. They think that this information is better than what we are telling them. And then when something goes wrong, they come back to us and they be like, yeah, but you didn't tell me. But I did tell you. Like that's like
Exactly.
it's a big dilemma. That's a big dilemma. And I agree with you on that. Unfortunately. Yeah.
And it's really hard to see the future going forward in the profession with that on one hand, with us being it like I could barely afford groceries and rent every month in Manhattan of New York. So it's sure. And you could say, well, get a cheaper apartment. Yeah, I would, but then I have to move further away, and then I'm not going to be right next to the hospital when an emergency happens. So
Yeah.
what do you want me to do?
What
And
could
you
you
know
do?
what? Like, it's not the argument is salary for residents. That's really what the argument is. It's not living situation. I'm not living in a penthouse. Like, so I mean, we could go into that too, but I want to make sure we hit all the points first, and then we can
Yeah.
we can backtrack a little bit. OMFS collaboration with other healthcare professionals and specialties. I would say the biggest, obviously, pharmacists prescribing
Yeah.
medications. You can do estheticians, with Botox injections, fillers, and stuff, kind of some overlap there. I would say in oral surgery residency specifically, we do have some collaboration with specialties such as plastic surgery and ENT. Those surgeries mostly involve cancer resections or,
Yeah.
big tumor resections of the jaw. And then when you replace the jaw with, say, a fibula or a scapula, some kind of graft, and those are generally combined procedures with other specialties, but mostly plastic surgery, sometimes ENT. So that's the collaboration and overlap that I've seen. Advancements in technologies in the field. Well, it's called what, a Yomi, where there's a robot that'll place implants now.
Oh yeah, I have seen that, but do we trust it? I mean,
You can trust it, but now you're taking 2 hours or an hour to place an implant that would normally take 15 minutes.
50. Yeah.
So I think that kind of technology, let's call that hardware. We're getting there.
Yeah.
We're not close yet, though. We're getting there. Software, on the other hand, I think artificial intelligence is going to have a profound impact on healthcare at large. And I think
Yeah.
it's quite misunderstood, actually, how profound the impact will be, how quickly it will happen, because the growth is exponential of AI. And it's not going to take people's jobs necessarily. It's going to be an adjunct. It's going to be your thinking buddy. It's going to be your
Like
diagnosis.
an extra. Yeah. Yeah.
Exactly. It's going to be a check, a
Yeah.
little like you pull it up. Let me just double check. Yep, yep, yep. That's exactly what I was thinking. Or, oh, look at this differential diagnosis. I wasn't thinking, you know, this and that, right? I think that's what it's going to be. And if you really want to talk about it, I think what the future will be as we go there over the next 20 to 30 years, the doctors are going to be picked. It basically AI is commoditizing information, and
Yeah.
doctors were typically picked for their excellent test scores. I think going forward, you're going to need excellent test scores. You're going to need to check the AI adjunctive tool for diagnosing, treatment planning, and such. But I think that will become number two, and number one in the future will become, because AI is just going to get smarter and smarter. It's already smarter than
Yeah.
the top medical school student in the United States
Agreed.
or an average medical. It's going to get smarter and smarter. We're not going to compete with that, right? And there's no
Agreed.
point in competing that. It's just it should be double check it for the right information.
Yeah.
That's going to be number two. I think number one in the future is actually going to be patient interaction, patient communication, patient comfortable. How comfortable is your patient? How much do they how well can you communicate with them on their conditions or the surgery that they're about to have? They were just diagnosed with cancer. Do you want a robot telling them that, or do you want a compassionate
Exactly.
human being that can talk with
Yeah.
that patient? Like, look, this is not the end of the world. We need to do this and this, and we're going to take care of you. Okay. That's the doctor that's going to become separated from the average doctor in the future, because they have all the AI technology to use to get the right diagnosis, treatment plan, to get the best possible outcome. But that patient needs to trust that. But that patient needs to be comfortable with that doctor, dentist, lawyer. So that's where I see it going. And it's going to be interesting how we see this play out. So, anyway, not
Yeah.
to rant on anyone's subject.
Yeah,
Next one
it's
is
a quite a big topic actually, and it's a very interesting topic. I agree, yeah.
it is. It certainly is. And my proof is you've seen how important ratings and reviews online have become.
Yeah.
Whether you're going to buy your webcam on Amazon, you're looking at the reviews, you're looking at the ratings, you're looking at how many of that product was purchased in last month. In fact, one of the inventions I want to create is a dentist rating portal where after the patient makes a payment, they have to review that provider immediately out of 5 stars, 10 stars, whatever it is. And then it'll rack up ratings throughout the day for that dentist. And then it'll help them gain more patients if they're doing a good
Uh,
job because
yeah.
it's patient centered care as it should be.
Yeah,
Right. So,
exactly, exactly. And that would be great because it's also great for the dentist because when you give him negative like rating, he might think like, okay, that's gonna affect me and that's how I'm gonna improve. So it's a win-win
exactly.
situation. Yeah,
Exactly. It is. And it could really hurt the doc. But if they're doing something wrong, then they're going to get a large quantity of bad reviews. And that's really what's going to, one bad review in here or there is like, okay, they just didn't align well with that patient, or that
yeah,
patient misunderstood this or that, whatever, you know, it, and you want to try to minimize that, but it's going to be the quantity of bad ratings that will bring down the
exactly.
overall score. So it'll tell, like you said, it'll tell the dentist, like, huh, maybe I need to see 5 less patients a day so I could spend time with everyone. Things like that, you know.
Yeah,
Advice for dentists wanting to pursue oral maxillofacial surgery. Well, it's very competitive to get into. My number one thing I usually recommend students that want to pursue oral surgery, like, look, you got to get good test scores. You need to get a good
yeah,
CBSE exam. That's the admissions test for oral surgery. But number one thing is do your best, but don't compromise your personality. Don't become a bad person. Don't become a negative competitor. Like
yeah,
there competition is good. It is friendly competition, respectful, professional competition. And then
exactly.
there's unprofessional competition. Like in dental school, I saw kids giving other students wrong test scores when they're studying for test answers when they're studying for a test coming up or stuff. Like that's just evil. That's
Unfortunately,
so
yeah.
and what they're trying to do is get other people to have wrong test scores so that they get better scores and the curve gets flipped. And that's just, you got to be kidding me. And I saw that a lot. I saw that a lot with orthodontists um, applicants. But that being said, that would be my
Unfortunately, this is
recommendation,
real. Yeah. Yeah.
right? Marketing in the medical field different from other fields. Well, it's not actually different from other fields. It's just, well, first of all, social media and marketing has generally been pretty demonized, right?
Yeah. True. True.
Like Like I make social media and I hear something about it in the hospital every day. And I'm not doing anything wrong. In fact, I'm trying to educate and mentor other students. I hear
Exactly.
it because it's just traditionally marketing and social media just hasn't been accepted throughout healthcare, right? And now
Agree.
you see all these students just taking pictures with the scrubs on, showing their butt, how good their butt looks in the picture, and it's kind of making it even worse. But I don't know. I don't do that. I'm just trying to give back and help. And I really want to lead the profession in the right direction. And we have a lot of work to do because we're not going in the right direction right now. For some of the things we just mentioned. So, marketing in the
Unfortunately.
field,
Yeah.
it's exactly, you either want to do it because you want to be an influencer and give out a discount code and make some money on your scrubs,
Exactly.
or you want to lead people and mentor and show them the right direction. That's kind of where I want to go with
This
this.
is where it should be, actually. I just want to comment on that because, to be honest, I agree with you that unfortunately, influencing like or influencers in the healthcare are getting more engagement than people trying to shed awareness or like give information. And at the end of the day, this image is being shown, and I personally think, like my personal opinion is this is unprofessional because at the end of the day we are being like we are healthcare professionals. We studied this for a reason. We have become doctors for a reason to shed awareness. We could use social media in a very nice way to spread
Yes,
information and make it more accessible for the bigger community. I mean, yeah,
exactly, exactly. And that's how I think we really need to do it. We can't do anything about the classic influencer. We
yeah,
can't, and that's fine. They could do their own thing. But what I think we need to do as a whole, as a profession, is utilize social media for the what I call pre-consultation. It
yeah,
allows patients to meet the dentist, doctor, lawyer before they even come into the office in person, face to face, and they get to meet that dentist virtually. They get to see what their family's like on Instagram or Facebook. They get to see
Yeah.
what their LinkedIn profile was. Where did they go to school? Where did they get their degrees? And so on and so forth. You're going to be able to get a gauge, an idea, whether you're going to be comfortable with this provider or not. That's what social media should be used for in healthcare. In addition to the personal stuff, like putting up a picture with your family, your friends, or going on the boat. Like
Yeah.
you can't dehumanize doctors and doctors, dentists, lawyers. They're humans too, right? We have families and
Exactly.
stuff, but we can't put on a face. I don't like the idea of having two separate Instagrams. We're one person. We're not a fake person and then a real person. No, 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 no. One thing.
True.
Um, so also we can't give out um, medical advice necessarily. So we have to be very careful. We could just kind of give our medical opinion. Opinion is very fine, but we have to make
Yeah.
sure it's known that it's not medical advice, right?
Exactly.
We could recommend, but we can advise. It's very hard. It's very hard. Like we can't.
It's like a thin line. It's a
It,
thin
it
line. Yeah.
exactly exactly. And a lot of people confuse medical advice and recommendation for opinion and opinion for recommendation, but all social, and I think doctors should go all in on it, right? But you're not diagnosing someone through the computer screen.
No,
We got to stay
of
away from
course.
that.
Yeah.
You know what I mean? But I think we should
Exactly.
explain to patients like, look, this is not medical advice, but it is my opinion that you should, if your tooth gets knocked out, put it in some milk, get to the hospital or to your dentist as soon as possible, or put it in milk a little bit, just rinse it off without washing it and put it right back, something like that. Like it's helping people, it's educating people,
Exactly.
and it's opinion. I don't know. It's a thin line, but like you can't hide medical opinions or advice from people because now you're de-educate. You're taking away education from the public. So
Yeah.
like I would fight against that too. You can't like diagnose and stuff. But all right, let's move forward. I think you
It's
get what I'm saying. It's a
yeah.
very tough subject, right?
Yeah, it is.
So effective marketing strategies, I think it's really like using less filters and
Yeah.
portraying yourself more as a human. I mean, you see me, I walk around as soon as I get out of work, I'm walking home, I'm just kind of holding the phone up and I'm just kind of describing what I did that day, or this is when I got out of work, or this is what you do, this is what I do for laceration repairs, stuff like that, right? Solely opinion, not medical advice. Let's keep going. Patient privacy and confidentiality. Um, so it's interesting because HIPAA, you're allowed to say a patient's age, gender, without going too in depth in their
Too
medical
indeed.
history, but
Yeah.
you are allowed to say that. Some institutions, however, don't even want you to mention anything about any
Anything.
patient.
Yeah.
So if you're in your own practice and such, that's fine. If you're under an institution, I would review their HIPAA guidelines, their patient information guidelines, HIPAA, as well as the HPI and the HPII, or you know what I'm saying. So it's very different per space. Ethical guidelines while marketing. Well, I mean, ethical guidelines while marketing. There's the influencer that's just trying to make a dollar for themselves. I'm not
Yeah.
supporting that. I don't
Yeah.
really agree with it, but they
Yeah.
can do it. Now, there's ethical guidelines where you're kind of manipulating situations to, I don't know, around your patients and stuff. That I don't agree. And I haven't seen that yet, though. I haven't. Oh, ethical would be filming your patient while you're doing it. Now,
Yeah,
that's where,
yeah. Or like not even filming your patient or like having a photo or like having sometimes the eyes are blurred or like you see those before and after photos or you like it doesn't have to be just dental wise like or so medical wise like a plastic
yep,
surgeon or like anything. You see those before and after photos or you see in surgery like like just a snippet. You do not see the face of the patient, but
yeah, yeah,
the patient himself would know it's him. Maybe his friends would know it's him. So sometimes I think it's a thin line on the subject because not everyone wants that or accepts that. And I don't think, I mean, I'm hoping that everyone is making those patients sign consent forms. But even if they
exactly,
sign those consent forms, so many times patients would come back and be like, yeah, but I did not want that to like I didn't want it to be posted or like if you know what I mean. So
exactly. Yep. And I think that should, yeah, the patient just needs to come back and say, I really like this to be taken down if
yeah.
that's it, right? So that's it. Consent forms and stuff. Exactly. Success of medical marketing initiatives. So it's very difficult because I'm seeing the healthcare industry at large become much more corporate. And then you have a lot of administrative higher ups, you have a lot of leaders that are kind of controlling their employees. And they do control their employees.
Yeah.
It's a whole control system. That's what the corporate system is. And as medical goes more corporate, like for example, the United States, dentistry is starting to go in that direction, corporatized, but hopefully it doesn't go too far because it's really, I don't know, it's creating dentistry become a lot more work and a lot less compensation, quality of life. On the medical side, there are two things. So there's the trade of what you're doing. Say you're a surgeon, right? And for the majority of what I can see, the medical side of healthcare in America, the surgeons, now there's some private practice, plastic surgery, ortho, but in general, I think most surgeons work at a hospital, right? Or an
Yeah.
outpatient that's connected to a hospital. The hospital bought that some within the last 20 years or so, right? Which is just adding to their corporate system. But in healthcare, you have the patient surgery, whatever that treatment plan interaction is. But then you have the financing of it and you have the marketing of
Yeah.
that patient, getting new patients, using that surgery to get new patients and stuff. And when the insurance companies started to take over the 60s, 70s, that they started to gain control of the financing of healthcare, right? Um, and then the marketing side is now really being controlled by the hospitals because they bought up all the private practices in the area and now they're marketing. And this is where this kind of gets into success of medical marketing and the future of marketing in the medical field. Well, the future of medical marketing, I was saying, like using it as
Yeah.
a pre-consult, but you're not going to
Yeah.
be doing a pre-consult under a big hospital system when you're doing your social media for your healthcare initiatives and your pre-consultation. They're not going to want you to do that because they want to control their marketing story, right? You work for them.
Yeah.
We're going to do the marketing for you now. And now
Exactly.
you're their employee. So in one instance, it takes a lot of your plate. They'll do it for you. But if you look behind the curtain, they're taking a big chunk of your paycheck. And that's
Enter. Yeah.
after the insurance company took a big chunk of your paycheck. So you're getting this. This is what you're getting. And you're working the same amount. They're not making you work less. You're working the same amount as doctors have in the years prior. You're working just as much. You're getting compensated even less. And they're doing a lot of finagling. I know some, like the anesthesia department I know of at a hospital system, started to require them to do, like, if you work overtime, you get extra money. If you work long call, they have like call and weekends and stuff, you get extra money. But now they're requiring them to, each of them, to work like one
Oh.
weekend every, I don't know, whatever it
Yeah.
is, right? In the
Yeah.
past, it was like you're going to make, say for example, you're going to make 350,000 starting out. And if you want to make more, you can work these weekends. Now they've changed this 2 or 3 years ago, where
Yeah.
now you're going to make $400,000. Sounds really good, right? But now we're going to require you, say once a month, you have to stay late or take a weekend call, whatever it is. I don't know the specifics, but it's fooling you. It's making you work more and you're actually making less because they should have increased your salary to 400,000 10 years ago. They just did it
Yeah.
now. And now you think you're making more money. They've been holding you back for that long. So I could really go into this, but um, it there's a lot of
It.
changes going on.
Yeah.
And so
Yeah.
it's getting a little sticky. And,
And it also
I,
depends on where you are. Like it depends on so many things. So yeah.
taxes, like through the
Yeah.
educational system, you think if I get really good grades, I follow the rules, I go right through the system, I get a really good degree, I go to a really good college, university, really good medical school or dental school, and I become the greatest surgeon around. I'm going to make so much money. No, first of all, that's not what you should be doing for. But taking a step back, if
Yeah.
that's what you think, sure, maybe you get a big salary. Half of that's being taken to taxes, though. And now, if we just reverse this, when you're in first grade and you're like, what do you want to be when you grow up? I don't know. Oh, I want to make a decent living. But you are working now more than most people out there in the world in their careers. And sure, you're being given a very large salary, but more than half of that is being taken. Is
Exactly.
tax a benefit or a penalty? So now you
Yeah.
just worked your whole life away. So this is a very deep question for another topic, but you
Yeah.
just
It
worked your
is.
whole life away and
Yeah.
now you're being penalized for doing really
For
well.
yeah.
more than anyone else out there. It's just an
This is the
interesting,
unfortunate truth. It's like a cycle, and it's the unfortunate truth. And to be honest, I would prefer if in schools they would have like, not even in schools, maybe at university or before, like in our high school, in our last years of high school, maybe someone to come and give us like a session about that, or tell us,
yeah,
explain to us that, because when we're young, we do not think about like what would be going on with taxes or
yeah,
like all this whole cycle. So yeah, unfortunately, we get into it and we don't know what to expect, and then when we get there, it's like there's no going back.
right. And you know
Yeah.
what? We're so involved in the educational system. If you know, we're kind of being told more and more to worry less about the marketing side, worry less about the business side. Just focus on doing what you love. Just focus on doing the surgery or
Yeah.
dentistry or dermatology that you love. That's all you got to worry about. We'll handle the rest. But then take this for example, COVID happened and then they shut down dental practices for how many months? You can't just flip and go work for another company. You have no training, you have no understanding of what that different industry is like. And now you're out of work for 3 months because of COVID. The government told you you can't go into
Exactly.
work. So now what? It put a lot of people in a very hard place. So it's very interesting. We aren't transferable across industries like some other people are in other industries. So
Exactly.
there's
Yeah.
a lot going on out there.
Yeah, exactly. I mean, I think the time is so limited right now. I'm not sure, like,
3.5 minutes. Yeah, we have 3.5 minutes.
yeah, I mean, there's a lot to talk about. This conversation is like, we kind of try to make like so many topics into a smaller conversation, but it's really like interesting, and it was a great pleasure like having you on the podcast and like discussing those things with you, because it's actually really important to shed the light on those topics. And yeah, I mean, do you want to say any final thoughts, any final
Yeah. So you're right now. It looks like it's nighttime where you are, right?
Yeah, it is actually 9 p.m.
9 p.m. And it's Monday for you too, right?
Yeah, 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 it
Did
is.
you work today? Did you have classes?
So
What was going on?
at this exact moment, I graduated like 8 months ago. And like at
Congrats.
the exact moment, I'm in my transfer. Thank you. I'm in my transfer timing, like waiting to settle somewhere else. I'm currently waiting for my documents to go and settle in Belgium, and work there.
Wow.
Yeah, because I want to also continue my studies over there in periodontology. So yeah,
Okay.
that's where I'm going now. So it's like in a few months I will start working again. So like now it's like a holiday for me, let's say. It's like a transitional phase.
Oh, excellent. Awesome. Well, I hope
Yeah.
you're enjoying the holiday for one, and
Thank
congrats
you.
graduating 8 months ago. Very well
Thank
done.
you.
When do you hear back? When do you get to know?
I didn't hear you. Sorry.
When do you hear back from the program in Belgium? When do you know?
So, I'm expecting answers in the next 2 weeks. So yeah, I mean already, yeah, yeah, it is. It is quite soon. Yeah.
It's coming up. It's coming up. What are you
Yeah.
doing for these 2 weeks? You said it's kind of like a holiday. What, anything fun? What are you doing for fun?
So in Cyprus it's already too hot, so like I'm enjoying my time by the beach. Like actually because I'm gonna also be moving out, so I'm enjoying my time with my family by the time I leave, because you know it's like I'm gonna move out, I'm gonna be alone. So yeah, I
Right.
won't see them for quite a good time. So yeah, I'm trying to enjoy my time with my family before I actually leave. Yeah.
Excellent. Of course.
Yeah,
Yeah, that you got to spend as much time with family, especially as you know through this career path. And then
exactly.
you're going to move to another country. You might not see them for
Yeah.
months at a time, right?
Exactly, exactly. And I mean, we're growing
Yeah.
up, they're growing up, so we have to like it's balance, you know,
Yeah.
especially with our very demanding profession.
Hmm. A lot of
Yeah.
sacrifices, a lot of time away from family, away from friends. It's difficult. It's not easy. It's not easy. And I mean, we have to make the most of it to make sure those sacrifices are worth it at the end. And putting our
Exactly.
happiness first, always.
Exactly. 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 I agree with you. I mean, it's worth it. I love what I do. I guess you do. It seems on Instagram I can see how much you love what you do. So it is worth it because it's what we wanted. So yeah, it is. It is worth it.
Exactly. Exactly. Well, it's probably going to end any second now. So,
Yeah, it
Cima,
was
thank
great
you again.
talking to you. Thank you.
Thanks so much. And we'll talk again soon.
For sure. Thank you. Thank you very much. Have a great day, I guess.
Yes, yeah. It's